Good morning, everyone, and welcome to another edition of Cross-Selling Ancillary Wednesday. Today we have ACA 101. I'll go through some of the basics of ACA and then some of the selling techniques and some of the things that we have available for you for ACA. So let me share my screen here and go into the presentation. Oops, hold on a second. All right. Okay, so what we're going to talk about today is this instructional presentation on getting appointed and writing the Affordable Care Act. Understanding the ACA and its requirements is crucial to providing affordable and comprehensive health coverage. What is the marketplace? The marketplace provides the health shopping and enrollment services for individuals and families, as well as employees and businesses. That part is called SHOP. SHOP is its own separate part, and it's really designed specifically for the small businesses. Mainly in the marketplace, what we're going to talk about is how you determine the eligibility and the coverage and the plans that you're talking about with your consumer. The plans and the advance payments of the premiums of the tax credits, the APTC, that is what they get is their subsidized premium. And then you have your CSR. Your CSR is your silver inside of a silver. And it is the best plan you can give them depending on their dependents and their coverage. So it's a great plan to always be aware of and try to get them into because it's the best plan for their least out-of-pocket costs. And like I said, deductibles, co-payments, and co-insurance, and Medicaid, and the Children's Health Insurance Program as well. The marketplace can be operated by a state or a federal government. There are key differences between the marketplace types of coverage, whether it's a state-based or a federal-based. And at the end, I will tell you the state. There are 22 that are state-based, and then the other are going to be federal. And the state-based are operated differently. They still have the metal plans. They still go by some of the same SEPs, but how you do it internally or how you get them is regulated differently. Consumers can use the marketplace to find and apply for health and dental coverage that fits their budgets and specific needs. Finding coverage, consumers in the FFM and the state-based can find coverage through healthcare.gov. There are other avenues. If you are going through a state-based, you really need to go through that state-based system, okay? Or you can go through the healthcare.gov, or you can go through Health Sherpa if you are in a federal state, the FFM state. So it really helps you out to have the Health Sherpa gives you your built-in CRM. It allows you to, have all your companies in one nice, neat platform and to be able to keep everything nice and concise and let you see what you sold that person, whether it be a Blue Cross, an Ambetter, a Molina, whatever it may be. It lets you know and it keeps you updated on if they have a payment or if everything is current. Applying for coverage, consumers can apply either online, by phone, or by mail, and may be able to get help in the marketplace. We want to make sure that they get it through us. We want to make sure that they use our NPN number to get coverage. So we want to help them enroll online to be more efficient and to get rewarded and to get compensation for our work. The marketplace plans must provide qualifying health coverage, including the minimal essential coverage for the health essential benefits. The following established limits on cost sharing, such as deductibles, co-payments, and out-of-pocket maximum amounts, and meet non-discrimination requirements, network adequacy requirements, and applicable state-specific requirements. That means you have to have a certain amount of doctors in a certain area. Each metal plan has its own specific mandatory loss ratios or copays, which I will show you here in a little bit. It gives you just a general outline of why a gold plan costs more than a silver, and a silver costs more than a bronze. It kind of gives you the outline of what you're looking at and why it does that. These are the 10 essential health benefits that every plan has to have. Okay. I'm not going to go read them all to you, but one of the most important things on here is that it's guaranteed issue. Okay. You cannot have a waiting period for health conditions. That's the most important thing. And that's one of the unmanageable or manageable situations that we have in the premium situations. The health plan categories, okay? These are the way they are done. So the bronze is the cheapest. Then you have silver, you have gold, and you have platinum. So the bronze, the health plan, the actuarial value is 60%, okay? And the consumer pays 40% of the costs. The silver, okay, is 70, and the consumer pays 30. Gold is 80, consumer pays 20. Platinum is 90, and the consumer pays 10. That's why the platinum is the most expensive. You don't see very many out there, and the gold is more than the silver, and so forth. These are all regulated and mandated by the metal plans and what you have. That's why you know that each plan is going to be more, and the copays are different because of their loss ratio percentages. Then you have a catastrophic plan. It's a high deductible plan. It covers basically, like I said, just catastrophic, but you have to be under 30 at the time they enroll for those who qualify for a hardship or affordable exemption. We don't see very many of these plans because usually if they're under 30 and they have a hardship, they have they qualify under the certain applied premium tax credit. So it usually doesn't come into play all that often. Who is eligible for coverage through the marketplace? To be eligible for coverage through the marketplace, individuals and households must live in the U.S. in a state served by the marketplace where they are applying, be a U.S. citizen, U.S. national, or lawfully present immigrant for the entire time they plan to have coverage and not be incarcerated. Okay, these are the requirements for getting coverage. The affordability program and the premium tax credit. This is the biggest part of the ACA. Okay, consumers with certain household incomes who are eligible for other qualifying coverages, like through job, Medicare, most Medicare coverages or CHIPs, may be eligible for savings through the marketplace. If consumers' projected annual household incomes for their coverage falls between 100% and 400% of the federal poverty level, they may qualify for a a premium tax credit. Okay, the premium tax credits are available to consumers who enroll in an individual marketplace plan through the marketplace. Eligible consumers can use all, some, or none of their premium tax credits in advance to lower their premiums, called applied premium tax credits. They're going to use all of it, okay? You're not going to have someone that is going to say, you know what, I'm only going to use half of it, or I don't want to use all of it till the very end. Then I'll get it back. Most of the times they're in need. They're going to be in need to use it right away. Okay, they need it right now to afford their premiums on their plan. Rather than paying $500 a month, they're getting all of that subsidized. If a consumer is ineligible for Medicaid based on immigration status, they may be eligible to enroll in a marketplace plan with a premium tax credit, even if they're under 100% of the federal poverty level, if otherwise eligible. Okay, so there are circumstances where immigrants can qualify under 100% and still get a premium tax credit. One thing I want everybody to be aware of here is that if you have someone who is under 400% of the federal poverty level, and let's say, and we tell all of our customers, especially in construction, let's say they had a semi-bad year the previous year, but they have a lot of jobs coming in the next year, their income may go over 400%. They may lose their premium tax credit. If this happens, they need to let you know, and we need to let healthcare.gov know, because they are going to lose their subsidized premium. And there's nothing worse than them thinking they're going to get back an $8,000, credit, or $8,000 back on their taxes. And Uncle Sam says, no, not only do you not get back $8,000, but you owe us $2,000. So always make sure that if your people are in a certain field of work that may be volatile to their income, that they let you know that if they are going to make over 400%, and I have the tax sheet in here of what it is for 2024, that they let you know what, hey, if you're going to be here, please, I want you to make more money, but let us know, because we need to take you off of the applied premium tax credit so you're not penalized, and let you know what your actual premium is going to be and work from there. Very important to know. Reconciling your tax credit. Okay, the amount of premium tax credit a consumer is eligible may change throughout the coverage year, like I just mentioned. If there are changes, we just talked about household determining factors. It's very important that consumers report these live changes to Marketplace. When consumers file their income taxes, they will have to reconcile their APTC that they were paid on throughout the year to reduce their monthly premiums. When the amount of the premium tax credit they were ultimately eligible for based on their actual annual household income. If you do not reconcile your applied premium tax credit, you will get charged it all back. Okay? Even if it doesn't matter what you had, $5 premium or whatever it was, you have to reconcile. It doesn't matter if you were over or under, it doesn't matter. You will get emails from the government. You will get emails from healthcare.gov. You will get from the carrier itself. You have to reconcile your applied premium tax credit. If you don't, they will assume that you shouldn't have received it, and you will get a letter in the mail to send it all back. Okay. If consumers use less than their premium tax credit and they are determined eligible for when they file, they will receive the difference as refundable credit. Like I said, most of the times it doesn't happen, but if they do go that route, they will get refunded. But most of the times, everyone's using it to pay their premiums up front. Some consumers who apply for coverage through the Marketplace and qualify for a premium tax credit but also qualify for extra savings called CSRs, cost sharing reductions. These are awesome plans. They are a silver inside of a silver that if a person can get them, this is what they want. They have the lowest copay, the lowest deductibles, the lowest out of pockets. Okay. The household needs to be between 100 and 250% of the federal poverty level. Be eligible for premium tax credit, which they are, enroll in a silver plan through the marketplace. A lot of times you can even filter out, I want to just look at CSRs if they have a CSR available. They're denoted by a gold star or usually by a certain figure. Okay. So there's all kinds of things that you can do to look at the more affordable, even the ultra affordable part of the ACA, and that's the CSR. Eligible consumers can enroll or change marketplace plans during the annual enrollment period during the OEP. There are exceptions. We have SEPs throughout the year. And so, if you have different changes of jobs and different things, and then you have the opportunity. In the FFM or individual or families, the OEP starts November 1st and ends January 15th. In most cases, coverage begins as soon as January the 1st for consumers who enroll by December 15th. Okay, so that's very important. And the shop is eligible, and they generate completely on a group enrollment at any point throughout the year. The most important thing here, team, that I want to come across is that the enrollment period is January 1st, November 1st, January 15th. December 15th gets you a January 1st. If you after December 15th, then you get a February 1st effective date. So that's the key point here. Okay, consumers can apply for marketplace coverage through either English or Spanish. We want to do it. We want to help them. Okay, so how to apply? We want to help them apply. We want to help them use our NPN number. We want to be a part of the process so we can make sure that we get commission and we get rewarded for our hard work. So when there is a question, there is a problem, and they call us, we can also be a part of answering that question. For coverage to become effective, they must pay their first month's premium, okay, direct to the insurance carrier. Even if you put them on a plan that is $1.25 a month, they have to pay that $1.25. Okay, if they don't, it will not be active. It will lapse. Even for that small premium, it will not stay active. So it's very important that you let them know they have to pay the premium. Put that $1.25 on bank draft. Okay, credit cards expire. If you send it direct pay, they forget. Always push bank draft as your number one solution to fund those cases. Okay, because like I said, I hate for $1.25. You got them the best plan. You went through the second or third page. You did everything you could possibly do, but you need to go and make sure they fund it, because if not, it will not go into effect, or it will lapse, even for the smallest of premiums. Consumers may want or need to end their marketplace insurance plans if they get other health coverage or for other reasons. How consumers should end their marketplace plans depends on whether the consumer is terminating the plan for everybody, or terminating coverage for only some people on the application. Okay, so depending on whether you want to go through healthcare.gov and get rid of everybody, or just go through and get rid of one person, I always double check with the carrier itself as well to make sure you have kind of double verify what you have going on. Many Americans have health insurance through their employer or a family member's employer. Consumers who are eligible for job-based coverage are generally not eligible for financial assistance through the marketplace unless their job-based coverage is considered unaffordable. Okay, but what does unaffordable mean? 9.1% of their income, their gross adjusted income, is unaffordable. Okay, so you take their annual income, you go by gross adjusted by 9.1%. You take that, you divide it by 12, and that amount is what, if their premium is more than that, that's what they would consider as unaffordable. Okay, 9.1%. So that's the number that you can use if someone says, some people may think $200 a month is unaffordable. Okay, or in essence, it's not unaffordable, just unaffordable to them. So what the government thinks is unaffordable is the number of 9.1%. All right, key points to remember. A marketplace is a way to qualify individuals and families to find and buy health insurance. The OEP for individuals and families generally runs November 1st to January 15th of the year prior to the year coverage begins. The enrollment period dates, the SBM may differ. Consumers may enroll in or change plans during an SEP if they qualify. States have the flexibility to establish their own marketplace. Individuals and households may be eligible for lower costs on their monthly premiums and out-of-pocket costs. You can call the Marketplace Center. I have called them before. I've had clients call them before because there was a problem with an enrollment, and they were very helpful. Okay, and if consumers don't agree with the decision, they can always file an appeal. But that 1-800 number, 318-2596, they are very helpful and sometimes very informative on what they can do to help you out. Okay. This is your FPL chart for 2024. If you have a single person, and they make over $58,000 a year, they are over 100%. They're over 400%. Sorry. And 14,580 is under 100% or over 100%. These are your penalties if you are less than and you're filing single or other statuses in there. So sometimes, even a single filing and they're over and they're under and end up being over, they're only paying a $900 penalty. They're not paying everything back. So sometimes being in that 250% or having a CSR is a lot more beneficial to them and having a penalty than not having a CSR and having more out-of-pocket costs depending on their health, on their health history. And I have this chart for everybody in a PDF. So reach out to me and I will get this to you. Yes, making sure. Here are some current SEPs for the 2024. The big one is 150% of the federal poverty level. And I'll go back. So if they make under $21,870 as a single person, they can enroll in an ACA plan all year long. Okay. This is a great place for people who work food pantries, who have low income areas, low income housing areas. This is the ACA gives us a lot more marketing leeway with CMS than we have with any other, business. So we're not tied to the things that we cannot say on ACA than we can with Medicare and some other things. So we're able to be a lot more aggressive in our marketing and what we say. So use that to your advantage. Okay. It can help you write more Medicare. It can help you be more successful. There is good money in ACA. Okay. They pay a per member per month. And in most cases, it's level or almost level commission. So we have a lot of great advantages to help increase your income. Talk about it under 150% of the federal poverty level. You can write them all year long. Medicaid unwinding. People who are losing Medicaid has just been expanded. Okay, so they are out there. They are needing help. Some of them can requalify for Medicaid. Some of them can't. They have an SEP to get. Change of household, denial of Medicaid. Someone is denied Medicaid, they have the ability to purchase an ACA plan and loss of job. If someone applies for Medicaid and gets denied, that gives them an SEP. Okay, so the first part of this was things about how to, what are the main things about the ACA, some of the guidelines, the restrictions, what to do. Now I want to go into steps and information needed to write ACA. Okay. You have to be FFM certified. Okay. If you're in the federal, if you are in a state-based, each state-based may have their own specific requirements for that state. So check with them and make sure that you are in that, you are licensed or signed up with that state. And I will read off a list of the states. I don't have them listed on my PowerPoint just yet. I apologize, but I will tell you what they are. But if you're in a federal based, then you will do the FFM certification at portal.cms.gov. The state-based ones are different. And I have a list of all the state-based ones and their websites. So get with me, reach back out to me, and I can get that with you as well. Health Sherpa or healthcare.gov are the two entities that we use to input the business. I like Health Sherpa as my first one. Even if I go to healthcare.gov, I will go into Health Sherpa first and then redirect me. It saves me my ID and passwords having to be redone and reestablished. And like I said, Health Sherpa is your built-in CRM. A lot of carriers will even use Health Sherpa as their platform to input business. My recommendation is do not go through them because they will just bring up their information. Go straight to Health Sherpa because then you can see all the carriers and what your competition is showing you. So don't go straight to the carrier. Go to Health Sherpa. Go to healthsherpa.com and go straight in because you can see more carriers and get more information. To ask for information, be able to get a proposal, you need age, income, tobacco use, dependents, and zip. Sometimes the best plan may be 2 or 3 pages in. Okay, so it's not going to be on the first page. It may be, your second or third page in, and it may have a $5 premium with it. That may be the best out-of-pocket cost for copays, deductibles, prescriptions, whatever it may be. That may be the best plan. So don't always stick by the first page because that may not be it. And a new scope. So we have a scope that has to be signed when you initially talk to the people. And when you change, any changes have to be made, it has to be signed as well. Okay. And I have the scope that I will give you. Again, it's on here, but reach out to me and we will get those to you to make your lives as easy as possible. Here's the CMS model of the scope. I have another version as well. It has the same information inside the scope. So as long as the verbiage is inside, it's fine. But this can be used as obtaining new information or redoing old information. Um, like I said, this is the main part of ACA. ACA is here to um, um, ACA is here to help you um, increase your annual income, to be more well-rounded, to be more, um, to help you be a better agent. ACA is such an easy product to sell. Um, Clients are always wanting to know, what do I need to do? How can I, they want a little assistance. Um, some of them are going to be more labor intensive than others, but it's a great way to, get your foot in the door for other, products and other, other brands of insurance. Talk to them about accident insurance. Talk to them about supplemental insurance to take the place of the out-of-pocket cost of their health insurance plans. There's always things that we can talk to them as insurance agents to let them know what we do and how we can be assisting them in their out-of-pocket costs. One thing that we have in our country is that, I'll leave it for a few more minutes, that we have an out-of-pocket healthcare crisis in our country. Okay. And that is what, let me go back here. So, and that is what our issue is here, is that we have an out-of-pocket healthcare crisis in our country. And we have to let our clients know that there's ways to solve these problems for, dollars a day, $1.50 a day. We're not trying to show them expensive, solutions. Things that we're trying to do are affordable, easy underwriting, things that they're not hard. But like I said, our clients don't know what they don't know unless we show them. Okay. Our clients don't know that, what we can, our clients don't know that we have all this ability, all these products that we can help them out with, if we're not, letting them know what we do. And you may tell one client something, and then down the road, they may talk to another client and go, oh, you know what? Joey told me about this. Give Joey a call. It wasn't for me, but it may work for you. So don't discount what you're talking to one person about, that they may lead to someone else, or they may talk to about someone else. So, conversation is our greatest ally. So having a conversation with one person and being able to, take that to someone else is a great thing. But the ACA, our other plans, alternative to ACAs that complement ACAs, we are very, here at Copeland, we are very proactive in wanting our agents to be well-rounded with all of our products, ancillary, cross-selling, the 62-year-old, the Medicare spouse in the house, all of these things that we want to, we want you to be successful. And your success is our success. So I hope that this was a helpful and informative ACA 101. It will be up on our Copeland YouTube channel for your reference. And anything that we can do to help you, be more successful, please reach out to the number on that last part of the slide. And everyone have a great rest of your day and week. And I will talk with you all soon. Thanks for joining, and I will be here next week. Bye.